This is a beautiful place to live, but we are not very healthy. Citizens of this area tend to be overweight, and smoking is still prevalent after all these years of warnings about our health. This conference being held in downtown Bristol was about finding solutions to our health problems.
So we're here to bring attention to the health issues that exist in this area and the common issues between Virginia and Tennessee. More importantly, though, we're here to bring together critical partners who can make a difference, because improving health is not only the individual's responsibility, but it's many different partners, some who you wouldn't even think about, folks in the business community, folks who make policy decisions at the local level as well as the state level. And there's great energy in the room, and I think there's really great opportunity to leverage many resources, particularly in a tough time economically, where we're distracted by many issues. It's nice to see so many people interested and involved, and we're here to cement that relationship and to move forward.
This is a meeting that brings together folks from both sides of the border, Southwest Virginia, Northeast Tennessee, to really talk about what we can do together to improve health of the entire region.
I think what's important for people to understand is that health provides an opportunity for happiness, and health and prosperity go together. So we have to stop thinking about health as something that we get and more about health as something that we have. And it's less about worrying about getting to the doctor than it is about worrying about the things we need to do to be able to stay out of that place. We want to be with our families. We want to be enjoying life. And it's really about creating the systems in our communities, in our counties, in our states, together in order to make that happen. That's what's really holding us back as a nation. It's not that we don't have enough health care, although that's important when you need it. It's that we're not focused enough upstream on our health. Wherever we are, maintaining that's what really provides us with the opportunity to be happy and to prosper.
So I think that we've created communities that don't necessarily foster health, and in fact maybe have many unintended consequences. And so I think particularly for the next generation, for our children, we really need to rethink some of the basic principles about how we design our communities, how do we design our organizations, businesses, and where do we invest our monies? And is there a better way of doing things, even creating roads so that roads allow not only cars, but they make it easy for people to walk and bicycle, and that becomes a daily part of their life, and encourage our children to build that into their usual day and build good nutrition into their usual day, so that it's not the exception, but it becomes the rule.
Well, I think the important thing for people to understand is that improving health requires us to have economic development and educational achievement. Those three things go hand in hand. And the reason we make that point is we want to bring business community, the education community, economic development, healthcare all together to say, hey, if we work together, we really can have a healthier region.
We've clearly seen significant issues with childhood obesity. The good news is we actually, for the first time, started to see a decrease in the very youngest of children who we followed. We've actually seen the weights coming down. So I think we're making impact, but we do have a long way to go, and we really need to bring attention to everybody's role in making that work. And it's so important for our children, because if they grow up severely overweight, then they're more likely to have diabetes and other chronic conditions that not only makes it harder for them, but it becomes a real burden to all of us in general, in terms of their impact to be a productive citizen and the healthcare costs associated with it and the healthcare needs for that matter. So we would much rather see in the future communities with healthier people and having actually to spend less dollars on healthcare than more.
Meetings like this are always important, both formally and informally. Formally, what we hope to do is to launch a dialogue about how we work together to improve health. Informally, what we're doing is bringing folks together who can say, hey, I'm doing this, I'm doing that, let's see if we can't do it together.